This is Chapter 16, Therapy and Treatment. In the first section of the chapter, we will explore how people with psychological disorders have been treated throughout the ages, discuss deinstitutionalization, discuss the ways in which mental health services are delivered today, and distinguish between voluntary and involuntary treatment. This is an overview of the mental health services that have been received in the year 2017 for adults in the U.S. You can see that overall around 42.6% have received services. These are some older statistics for children, adolescents in particular in the U.S. Around 49.5% of adolescents in the U.S. have a mental health disorder. Understand that this ranges from mild to severe. Most of these cases are mild. And you can see at the bottom the different types of disorders that children between the ages of 8 to 15 have and the rate for our country. It's about 1/3 to 1/2 of the adolescents that have mental health disorders that actually receive treatment. That's similar for adults as well. So it's important to understand that everyone who has mental health disorders does not actually receive treatment for it, unfortunately. And hopefully this chapter will help to shed some light on why, and hopefully to help you to encourage those around you and maybe even yourself to seek treatment. So in the past, the way that mental health disorders were treated were frequently through asylums. It's important to remember some of the historical issues within psychology that were discussed in the first chapter. Remember that the presence of abnormal thinking and abnormal behavior used to be believed to be associated with being possessed. And so as a result, the treatments were not necessarily treatments, but really forms of trying to release someone from their possession. As our knowledge grew, so did the response to people who needed help grow. So asylums were the first institutions created for the specific purpose of housing people with psychological disorders, but the focus was ostracizing them from society rather than treating their disorders. Philip Pinel came along and argued for more humane treatment of the mentally ill, and through much effort and time and the contribution of others as well, that did eventually happen. Deinstitutionalization is the closing of large asylums by providing for people to stay in their communities and be treated locally. Dorothea Dix is often given credit for making huge contributions in this area. Her efforts led to reform of mental health care in the U.S. Today, in modern mental health treatment, most mental health treatment is actually outpatient, meaning that people are not staying within institutions, but we do still have institutions that treat people who are experiencing psychological disorders. They are nothing like the asylums, though there can be lots of improvements made. Treatment can be involuntary or voluntary. Involuntary treatment is much less common, but this happens when others will advocate on behalf of the person to receive treatment, and the person may not be ready to receive treatment. This often is for severe cases of mental health disorder, when the person is not functioning in a capacity that allows them to make rational decisions, and they are a threat to themselves or others. Voluntary treatment, which is much more common, means that the person chooses to attend therapy to obtain relief from the symptoms that they're experiencing. So we'll look now at types of treatment. In this section, we'll distinguish between psychotherapy and biomedical therapy, recognize various orientations to psychotherapy, and discuss psychotropic medications, and recognize which medications are used to treat specific psychological disorders. So in general, psychological therapy is divided into two categories: psychotherapy and biomedical therapy. Psychotherapy, which is also referred to as psychodynamic psychotherapy, is psychological treatment that employs various methods to help someone overcome personal problems or to attain personal growth. Biomedical therapy, on the other hand, is treatment that involves medication and/or medical procedures to treat psychological disorders. You can see in the table here various psychotherapy techniques, and I will talk about each kind. So we start with psychotherapy, psychoanalysis. Remember that the foundational therapy tool is psychoanalysis, and it does come from Freud's theory of psychodynamic experience. The way that that is practiced is usually in a much more modern and eclectic way today, but there are still some people who practice psychotherapy in a very traditional and Freudian manner. So psychoanalysis, again also known as psychodynamic psychotherapy, is a psychological treatment that employs various methods to help someone overcome personal problems or to attain personal growth. Some of the techniques include free association, dream analysis, and transference. Free association is a technique in psychoanalysis in which the patient says whatever comes to mind at the moment. It's then the therapist's job to analyze what the patient is saying. In dream analysis, the patient recalls their dreams and the psychoanalyst interprets them to reveal unconscious desires or struggles. Remember, Freud was always very interested in the conflict that we would experience between the awareness and the lack of awareness that we have in our experience. And then transference is a process in which the patient transfers all of the positive or negative emotions associated with the patient's other relationships to the psychoanalyst. It is an expected part of the psychoanalytic relationship, and the therapist is trained to be able to highlight when transference occurs to the patient and then to utilize it as a tool for growth. Play therapy is a therapeutic process that's most commonly used with children. It employs toys to help them resolve psychological problems. We find that very easily when children are engaging in play, in story time, that type of fantasy-based play, that they will often reveal problems that they are experiencing through their play. The technique uses a therapeutic process of play to help clients prevent or resolve psychosocial difficulties and achieve optimal growth. We also have behavior therapy, which is very much rooted in the ideas of behaviorism, but in a modern way. So it's a therapeutic orientation that employs principles of learning to help clients change undesirable behaviors. It can include counter-conditioning and aversive conditioning. Counter-conditioning is classical conditioning in which a client learns a new response to a stimulus that has previously elicited an undesirable behavior. So if you will remember in the learning chapter, we had in class the video that I showed you of the toddler who was having a hard time putting away her dishes. If we were to use counter conditioning with her, we would try to find a way to switch the association that we had, and that was actually an activity that we did in class. With aversive conditioning, we are going to pair an unpleasant stimulus with an undesirable behavior. And so one of the most common for this is the drug that is used to help people who are suffering from alcoholism. They pair that drug that makes the person physically ill with the alcohol, and that helps to kind of train their nervous system through classical conditioning to associate drinking with illness. Other types of behavior therapy include exposure therapy and systematic desensitization. In exposure therapy, a therapist seeks to treat a client's fear or anxiety by presenting the feared object or situation with the idea that the person will eventually get used to it. With systematic desensitization, phobias and anxiety disorders are treated by exposing a person to the feared object or situation through a stimulus hierarchy. And what this means is that they are gradually and progressively exposed to the thing that they fear. So initially it might just be a conversation, then it might lead to pictures or video, and then it might lead to actually experiencing the thing that is feared. There's also virtual reality exposure therapy and token economies. Through virtual reality exposure therapy, it's similar to what was just mentioned, but they're using actual visual imagery to help people conquer their fears. In token economies, these are used typically in groups. They're in controlled settings where individuals are reinforced for desirable behaviors with tokens that can be exchanged for items or privileges. And this may sound familiar. Sometimes this is used in kindergarten or with small children. It is often used in, again, group situations like group homes, sometimes even in prison. Another form of psychotherapy is cognitive therapy. Cognitive therapy is a form of psychotherapy that focuses on how a person's thoughts lead to feelings of distress, with the aim of helping them change these irrational thoughts. Dr. Aaron Beck is often credited for being a leader in this area of therapy. They give you an example of how his theory says that our thoughts can lead to negative emotions. So if you fail a test, you can internalize beliefs about the experience, or you can not do so. So in the case when you internalize beliefs, you may associate the test failure with you being stupid, and as opposed to associating it with your behaviors or lack of behaviors. If you do internalize that experience, then thinking that you're worthless and stupid is likely going to lead to you feeling depressed. The thought leads to the feeling. On the other hand, if you do not internalize that belief, if it is external, then you may think, I'm smart, but I didn't study for this test and I can do better. So the emphasis here is on the behavior instead of internalizing it as it being some type of inherent flaw. In this case, without internalizing the beliefs, you will not experience the depression. Look now at cognitive behavioral therapy, which is combining emphasis on thoughts but also behavior. My favorite form of cognitive behavioral therapy is rational emotive behavioral therapy, or sometimes referred to as rational emotive therapy, RET. It's a form of cognitive behavioral therapy that emphasizes identifying and disputing irrational thoughts. Cognitive behavioral therapy in general is a form of psychotherapy that aims to change cognitive distortions and self-defeating behaviors. Frequently, the ABC model is adopted. That means that there's an acknowledgement of an activating event or an action that follows with a belief about the event. So this is the way that we interpret or appraise the event. And then there are the consequences of that belief. There's also humanistic therapy. Humanistic therapy is an orientation that's aimed at helping people become more self-aware and accepting of themselves. The huge emphasis is client-centered therapy, which is a theory and process that was developed and promoted by Dr. Carl Rogers. So it's a non-directive form of humanistic psychotherapy. Non-directive meaning that it's not the therapist's role to tell the client what to do, but instead to emphasize unconditional positive regard and self-acceptance. Non-directive therapy, again, is an approach in which the therapist does not give advice or provide interpretations, but instead helps the person to identify conflicts and understand feelings. So if there is less of a hierarchy in this relationship, it's not an assumption that the person is coming to the therapist because the therapist is all-knowing and is going to fix them, but rather that the person is coming to the therapist as a collaborator in the process of their self-awareness and growth. Unconditional positive regard is a fundamental acceptance of a person regardless of what they say or do. It's a term that's associated frequently with humanistic psychology. So according to the American Psychological Association, 3 factors work together to produce successful psychotherapy treatment. The first is the use of evidence-based treatment that is deemed appropriate for the particular issue. The second is clinical expertise of the psychologist or therapist. And the final is your own characteristics, values, preferences, and culture. These things working in together in harmony, are going to produce effective psychotherapeutic treatment. We'll look now at biomedical therapies. Again, biomedical therapy is a treatment that involves medication and or a medical procedure to treat psychological disorders. It coincides with the medicine model of mental health treatment. Under the medical model, the belief is that when someone is experiencing mental disorder, psychological disorder, that they are experiencing it as a disease in the same way that you would experience a disease in your body. And so the treatments are treated in a similar fashion as you would treat something that you're experiencing in your body, pills or, again, procedures. Psychotropic medications are typically prescribed by MDs, usually a psychiatrist. Remember, a psychiatrist is different from a psychologist in that they are a medical doctor who has additional training in the area, typically of psychotherapy or psychology in general. In some places, psychologists are able to prescribe medicine as well. Electroconvulsive therapy is a procedure that is used, and transcranial magnetic stimulation is a similar procedure that is used. So this is a modified medication table, and we start by looking at antipsychotics and antidepressants. In our country, we have the highest rates of diagnosis for mental health disorders, as well as the highest rates of prescriptions for psychological disorders. In particular, antidepressants are among the highest. So antipsychotics can be used to treat positive or negative symptoms of severe mental health disorders, including schizophrenia, and antidepressants are typically used for depression and anxiety. There are also anti-anxiety agents, mood stabilizers, and stimulants. Anti-anxiety agents are typically used to depress central nervous system activity and to, again, assist with anxiety as a result. Mood stabilizers are typically used to treat episodes of mania as well as depression for bipolar disorder. And stimulants help to improve the ability to focus on a task and maintain attention and help with impulse control. These are frequently used with ADHD. Electroconvulsive therapy, or ECT, is a type of biomedical therapy. It involves using an electrical current to induce seizures in a person to help alleviate the effects of severe depression. We'll look at treatment modalities now. We'll distinguish between the various modalities of treatment and discuss the benefits of group therapy. The first part of any treatment is the intake process. It's the therapist's first meeting with the client in which the therapist gathers specific information to address the client's immediate needs. So the very first time that you meet with the therapist, it's not usually getting into an actual therapeutic session, but providing background information. Confidentiality is a part of any therapeutic relationship. The therapist cannot disclose confidential communications to any third party unless they're mandated or permitted by law. Therapy can be individual. This is when the client and the clinician meet one-on-one. The clinician works with the client to help them explore their feelings, work through life challenges, identify aspects of themselves and their lives that they wish to change, and to set goals to help them work towards these changes. Therapy can also occur in group settings. In group therapy, typically 5 to 10 people will meet with the same issue or concern, and a trained clinician will guide or facilitate that meeting. The clinician meets together with several clients with similar problems. Therapy can also occur for couples and for families. In couples therapy, 2 people in an intimate relationship who are having difficulties will meet with a clinician who will help them resolve those issues. In family therapy, the individuals can meet sometimes one-on-one with the therapist and often then collectively to address issues within a family. In strategic family therapy, the therapist will guide the therapy sessions and develop treatment plans for each family member for specific problems that can be addressed in a short amount of time. We'll look now at substance-related and addictive disorders. We will focus on recognizing the goal of substance-related and addictive disorder treatment, discuss what makes for effective treatment, and describe how comorbid disorders are treated. Comorbid disorders are when an individual has 2 or more diagnoses, which often includes a substance abuse diagnosis and another psychiatric diagnosis, such as depression, bipolar disorder, or schizophrenia. It's very common for people who are experiencing psychological disorders, particularly those who are not actually receiving treatment, to self-medicate. And so they will have the presence of a psychological disorder and also use typically an illicit, illegal drug to self-medicate. This is a very ineffective combination. In cases of comorbidity, the best treatment is thought to address all disorders simultaneously. This is also sometimes referred to as dual diagnosis. We'll look now at the sociocultural model and therapy utilization. We'll explain how the sociocultural model is used in therapy and discuss barriers for mental health services among ethnic minorities. So the sociocultural perspective looks at you, your behaviors, and your symptoms in the context of your culture and background. And remember, as I've said several times before throughout the semester, culture affects every part of your experience. Cultural competence is the therapist's understanding and attention to issues of race, culture, and ethnicity in providing treatment. Statistically, ethnic minorities tend to utilize mental health services less frequently than white middle-class Americans. The reasons for this are lack of insurance sometimes, if we're talking about low-income ethnic minorities, transportation, time, access to care, and then when socioeconomic status is not a barrier, perceptions and attitudes. Frequently, there are different perceptions and attitudes within different ethnic cultures that do not recognize or value mental health treatment.